here to talk to you about acne today. Acne is something that I think affects most people sometime in their life. When we talk about acne, we have to think about an inflammatory disease. It's an inflammatory process. So what we eat, what we ingest also makes a difference. The way I look at acne and the way I like people to understand it is that it is an organ that is showing a symptom. So acne being on the skin, your largest organ, is showing that you have an inflammatory disease process. Sometimes that means that there's something also going on internally and it's a symptom rather than a diagnosis or a disease process itself. So when we look at acne, we also like to look at people's diet, their habits, their sleeping habits, their stress levels. Inflammatory acne is more likely also caused by dietary habits. So we have to talk about, is lactose causing an issue, is gluten causing an issue? I always suggest the patients to eat leafy greens, but we also talk about what kind of makeup they use, what kind of conditioners, what kind of shampoo they use. All these are factors that we have to incorporate when thinking about acne. When looking at our acne patients, each person who gets evaluated is going to have a different plan of care because nobody's acne, nobody's skin, no one medically is the same. If we're all the same, that'd be pretty boring. But looking at our acne patients, we have different types of cleansers that we'll suggest depending on what we need to do, whether it's cellular turnover or unclogging of pores or whatever it may be. We incorporate a whole regimen. Our regimen includes topical medications, washes, sunscreens, as well as acne treatments themselves. So our licensed esthetician who's well versed in acne would be working on doing what we call acne treatments, which is getting the surface acne to calm down as the medications are doing their thing at a lower level. So when we talk about acne, I also like to know about people's lifestyle. Are they drinking enough fluids? Water is extremely important when we're talking about skin in general. Again, green leafy vegetables, a lot of people don't like it, I understand. Find a way to like it. It's important for your skin. You are what you eat. When we look at topical medications, we're going to choose stuff that should accommodate the type of acne and also that someone can tolerate. You're not going to be compliant. You're not going to do what I ask you to do if your face is burning and itching and peeling. It's just not going to happen. Sometimes we include supplements that help also. When we talk about your shampoo in depth, that makes a big difference, especially when looking at forehead acne or those who exercise or are sports, teenagers, football players, so on and so forth. Whatever you put in your hair whenever you're sweating is going to come down to your skin too, right? So if we're using thick conditioners that are oil-based, they're actually going to worsen things. The other thing we need to consider is if we are doing sports, we need to wipe the face down. Make sure your face stays as clean as you can. You need to wash twice a day. When we talk about washing, I also like people to use either a washcloth or a Clarisonic or something along that nature. Just like think about your dishes. When you wash your dishes at home, do you just rinse them and then put them on the shelf and then you use them later? No, and we don't want you doing that with your face either. You get a sponge or a washcloth and you wash that plate. You get that oil off, that grime, whatever you ate off of that plate. It's the same thing with your skin. We want you to wash well and wash twice a day. We want you to use good topical medications as well as good topical cosmeceuticals. And those cosmeceuticals that we carry are the ones that we like best, that are well researched, have multiple medical data to back them up saying how they help. The other things we like to incorporate besides your activity, your shampoo, is your skincare. What skincare you're using, and is it best suited for you? Do we only use things that are in our clinic? Absolutely not. There are versions or other things we do like that are over the counter or easily found or more cost effective. What I suggest is everyone make a consultation. Your insurance does cover it. So you come in, we talk about all these things, your lifestyle, your shampoos, your conditioners, your washes, your eating habits, because everything affects everything. There's not one organ system in your body that's going to react without another organ system being affected. It all works together. After a medical evaluation, we'll talk about whether acne treatments, lasers, or what other venues would be important to you and what would be most beneficial for you. Incorporating everything I'm asking patients to do, as well as doing acne treatments every 2 weeks for 6 weeks. My goal is to get their acne 60 to 80% reduced by week 6. That being said, that happens 95% of the time. There are a few cases that need an extra 2 to 4 weeks. I do urge everyone today, or anyone who's watching this, to make an appointment. Very simple. Again, it's your copay and it's your family practice copay. For the acne treatments themselves, we have a few options in payment, either lumping them together at a very affordable rate or seeing if your insurance is one of the few that still cover acne treatments. Please feel free to call us with any questions. I encourage you to make an appointment, and thank you for your time.